channel. We're going to start with palpations today. And I'm going to feel for any deformities, any types of swelling, where is most painful, which is the TTP, where the focal or depressed pain is, and then crepice, which is like any cracking or popping in any joints or anything.
First is the first MTP joint, then next is the navicular, and we can feel the bone sticking out on the medial side, and it's going to go all the way around right here. And then next is the talar head. We can feel it when I put my fingers together, and then I'm going to have you evert. Then you can feel two little bones moving, which is the talar head. And then the tibial crest is going to be on top right here, and then as well as the tibia. Right here. And then next is the medial malleolus on the medial side, then the lateral malleolus, and then the fibular is going to be the bone on the lateral side right here, and then for the shaft we're going to feel it through this, then we lose it in the gastrocnemius, then we can feel the fibular head on the top when she moves her foot up and down. You can feel it right there. Then next is the calcaneus, which is going to be her heel right here. And then the calcaneus brusa, I'm going to pinch her back here, and we can feel it right here. And then the Achilles tendon is right behind her shin or her tibial crest, and we can feel it right here. The styloid of the fifth, we're going to go down on the lateral side, and we can feel this bone right here, and that is the styloid of the fifth. The sinus tarsi is on the lateral side, and it is this little gap of skin right here. You can feel. And then next is the ankle ligaments, and then this is going to be the ATFL in the front, the CFL on the side, the lateral side, and then PTFL behind. And then on the medial side is the deltoid ligaments. And then the last one is the cranial muscle is going to start up here, and we're going to have it wrap around the lateral malleolus, like this. Okay, next we're going to test the range of motion in the special test section. So first we're going to start with the active range of motion, which is going to be testing for muscle injuries, and it indicates if there's pain, know what the injury might be. So I'm going to have you put your toes to your shin, which is dorsiflexion. Step like you're stepping on a gas pedal is plantarflexion. Point your toes towards the desk is inversion, and then towards the camera is eversion. And then next is passive, which is I'm going to perform it on you, if that's alright, and it's testing for ligament injuries. So I'm going to do dorsiflexion, plantarflexion, inversion, eversion. Then the last one is resistant range of motion, and it's going to test for muscle strength. So I'm going to put your foot in dorsiflexion, like this, then press down like you're stepping on the gas. It's testing for plantarflexion, then go up, it's dorsiflexion, and then towards my hand is inversion, then this is testing eversion. Perfect. Now we're going to do special test part 2, which is the manual muscle test. We're going to start with dorsiflexion and eversion, so I'm going to put her foot in that, and then I'm going to try to get her into eversion and plantarflexion, stabilizing her. And that's testing for fibrillaris tertius. Now next it's going to be plantarflexion and eversion. Then try to get her into inversion and dorsiflexion. And that's testing for fibrillaris brevis and longus. And then next is going to be dorsiflexion and eversion. Then try to get her into inversion and plantarflexion, stabilizing her tibia. Next is going to be plantarflexion and eversion. I'm trying to get her into eversion. Okay, change angles to do the test for the gastrocnemius, which is going to be her foot in plantarflexion and knee extension. I'm going to try to get her into dorsiflexion. And she's good. And then, okay, now we're going to test for the soleus, which is going to have her knee in flexion and her foot in plantarflexion. I'm going to try to get her out of it. Next, we're going to move on to special test for the ankle, and we're going to test for ankle sprains. First is going to be the anterior draw test. I'm going to stabilize the tib and fib with one hand, and then I'm going to grab the calcaneus with the other. Now I'm going to apply anterior force. And I can feel it stopping, so that means that the ATFL ligament is intact. Otherwise, it would keep going. It wouldn't stop. Next, we're going to do the inversion talar tilt, and we're going to stabilize the tibia with one hand, and then grab the calcaneus with the other. Now I'm going to try to tilt it into inversion, like this. And that is testing for the CFL ligament right here, and as you can see, it stops, so it's intact and it's healthy. No sprain there. And then the posterior draw test is I'm going to stabilize once again, grab the calcaneus, and apply the posterior force downward. And then this is testing for the PTFL joint, or ligament in the back, and as you can see, it stops again, so she is ruled out for a sprain there. And then the inversion talar tilt, again, I'm going to stabilize, grab the calcaneus, and put the foot into eversion. As you can see, it like stops, it's not pulling through, which means her deltoid ligaments are intact and ruled out for sprain. And then next is going to be the Clyder's test, and we're testing for a deltoid ligament sprain and a symptomatic ankle sprain. So I'm going to stabilize, foot in neutral, grab her calcaneus in neutral, and twist her into eversion, and then put her in dorsiflexion, and then do the same. And it's intact still, so we're going to rule out both a deltoid ligament sprain and a symptomatic ankle sprain. And next we're going to move on to the cotton test, and I have her lay on her side. And then next is the cotton test. I had her lay on her side. I'm going to stabilize the tibia, and then apply a lateral force, just like this. Again, we can see that it stops, it doesn't pull through, which is going to rule out and test for a symptomatic ankle sprain. So we're going to rule out a symptomatic ankle sprain with the cotton test. Next, we're going to do the bump or percussion test. So I'm going to put my patient in dorsiflexion, so up straight, and apply a firm bump to the bottom of her calcaneus, like this. Any pain? No pain. Alright, so we're going to rule out a fracture, because if there's a fracture, they don't like vibrations, and that would affect pain, probably excruciating pain wherever the injury might be. Next, we're going to do the squeeze test for the ankle eval. So I'm going to place her foot in neutral, and then place my heel of the hands at equal levels of the tib and fib and squeeze. And if there's any pain with that, we're going to have to rule in and consider it being fractured if there's pain. So this side, so you can see it, hopefully. Any pain with that? No pain. Alright. My patient laying on her stomach like so. She looks very comfortable. I'm going to have this foot. I'm going to have her relax as I squeeze the belly of her gastrocnemius muscle. And we can see her foot will do a little motion. And if that doesn't happen, we can rule in a ruptured Achilles tendon. So let's see. So you can see how it's moving in and out. So we're going to rule out a Achilles tendon rupture. And then next is the Homans test. And I'm going to find the middle of her gastrocnemius, and then apply pressure in that spot while her foot is in dorsiflexion. And then pain with this, we can rule in the trombolimbius, or also known as the deep vein bonus, the BVT. So I'm going to find the middle of it and apply pressure. Anything with that? Alright, we're going to rule that out. Okay, now we're going to do a special test starting with the range of motion for the feet. I'm going to have my patient put her foot out, and I'm going to have you put your toes to your shin. This is dorsiflexion, and then push down with your sub-belly gas pedal. Is, I think you have to do it twice. I don't think you need to do it twice here. Is plantar flexion, point your toes towards me, is inversion, away from me, is extension, is putting my foot forward, and then curling my toe would be toe flexion. Is the passive range of motion. Her doing it herself was active. So, dorsiflexion, plantar flexion, inversion, eversion. Toe extension with passive range motion, then toe flexion. I'm going to test for those, which is the resistive range of motion. Plantar flexion, press down, is testing for dorsiflexions. Put your toes towards me, push against it, it's testing for inversion, then push towards me, it's testing for eversion. Resistant range of motion for toe extension, like this. And then for toe flexion would be like this. Okay, and then we're going to do the manual muscle test for the toes. We're going to start with big toe extension. So I'm going to try to pull her out of extension. Strong. And then I'm going to do it for the other 2 through 5. Strong. And those are, the big toe is testing for extender hallucis longus, and then the toes 2 through 5 is testing for extender digitorum longus. Okay, we are going to do a special test for the wind loss and supple test, which is testing for the pes planus. So I'm going to observe while she's seated like this in a neutral position that her foot does have an arch, quite a big arch, beautiful arch. And then I'm going to have her stand up for me and see if the arch is still present. So can I have you stand up for me? The arch is still present, as we can see. And then I'll have you go onto your tippy toes. Again, arch is still present. And no pain. Was there any pain with that? Mm-mm. So we can rule out the plantar fasciitis. Interdigital neuroma test. And this is going to test for pain in between the metatarsal heads. And if she has pain, she's likely to have a neuroma. No pain, she should be ruled out for that. So I'm going to, her foot's in neutral. I'm going to squeeze the metatarsal heads together for 1 to 2 minutes. Does that cause you any pain? Constant for neuroma. She might have neuroma because the hat is painful to her. And then we're going to do that same thing and then roll the metatarsal heads. And we'll see if there's pain with that. I have a neuroma. So she's positive for both, so she's likely to have a neuroma. Alright, moving on, we have the thumb and index finger squeeze. So we're going to have the patient spread her toes wide, and I'm going to squeeze symptomatically in between the metatarsal spaces. So spread your toes for me. Spread your toes. Alright. Any pain? No. So she's negative for pain for here, which is also testing for neuroma. So it's like a question if we should rule it in or not. Because the other test was positive, this is negative. And last we're gonna do the T-now test, which is gonna test on her medial malleolus for pain or tingling, and that will cause pain to the nerves, which is going to be that tarsal tunnel. So I'm going to tap right here. Any pain? No. Alright, so she should be good. Moving on to the special test for fractures, and we're going to start with the long bone compression test. So I'm going to apply compression forces onto her big toe or metatarsal, and if she has pain with this, we can rule in a fracture. Do you have any pain? No. Alright. Next we're going to do the torque test. We're going to apply pressure like this, and I'm going to twist. Any pain? No pain. The other way. No pain? No pain. Right, so we're going to rule out fractures in the metatarsals. Okay, now we're going to do the tap test. And I'm going to tap the top of her phalanges and look for an injured metatarsal. Any pain? No pain. Alright, so we're going to rule out a fracture in the metatarsal or phalange. Next, we're going to do the bump or percussion test. I'm going to put my patient in dorsiflexion, so up straight, and apply a firm bump to the bottom of her calcaneus, like this. Any pain? No pain. Alright, so we're going to rule out a fracture, because if there's a fracture, they don't like vibrations, and that would affect pain. Probably excruciating pain rather than injury, it might be. And that's going to be all for the special test of the foot. Yay!